So the first joint mobilization I'll show you is that of the shoulder, because I use it quite a lot. Is very handy. People carrying a lot of stress there. And what I'll ask Utkarsh, if you can bring our friend here, good, without the hand, without the arm, because yeah, okay. And what I want to do, and every time we'll try to do that as much as possible, is to make that a revision for the anatomy. Okay, so what we're going to do is mobilize the shoulder complex, I call it, which is the scapula and which name of the bone is here? Clavicle? Humerus. Good. So these are the three bones that I'm going to mobilize, and really the scapula and the clavicle works together and they carry on the humerus on. So when I do that, imagine that the scapula lift up, the clavicle also lift up, and the humerus attached to it. Yeah? Good. Which muscle do we need to consider when we're doing this? So trapezius up to here, deltoid from here to here, triceps on the back,
Pectoralis major, is it?
pectoralis major, where is it? It's in front, yes, this muscle.
Levator scapulae?
Levator scapula, definitely. Levator scapula runs from the middle border to the lateral of the neck. Yeah? Scalenes, yes. So attached to the side of the neck to rib 1 and 2. Erector spinae, yeah, erector spinae muscles. Yeah, I think that we're doing pretty good. And biceps, yes, on the front. Okay, so we could leave that into here. Now, the problem I find, and that's really before start doing the movement, is that most clients, if you do this kind of movement, they will not trust you. And it's nothing to do personally. It's just their body feel there is no support. So you need to build the support excellent if you want to let go. It's like a therapy, yeah? If you want the person to open up, or friendship, you need to support them, yeah? And that's not a good support. Now, Alicia is, she's a therapist and she knows that and she will relax, but your client would not relax with it, yeah? So how do you support the joint? What you do, you need, if you have 2, is better than 1. So this is the worst, yes? And this is the worst, Iken, and this is a little bit better. Why is this one is a little bit better? Because I moved my body, yeah? This one is a little bit better. Why? Because now I have 2 points of touch and there is more support. I find that 3 points is really the stronger support that you can offer. So what I do, I start counting the position. So this is 1 point, this is 2nd point, and that's the 3rd point. And now with these 3 points, I can support quite good, and I can actually move as I go, and she would feel quite relaxed, and then I can do a lot with it, yeah? Please, yeah? So I can stretch it, I can move it up, and when I move up, which muscle I put into laxity? Trapezius, yes. Do you know what laxity is?
Less stretched.
Opposite of stretched, yes. So it's, remember the towel? Yes, this is stretch, this is lax. And then you can massage with laxity, it improves the blood circulation. So again, 1, 2, 3. Now, the tendency is first to close their blood circulation with your thumb. You're so stressed that you put a lot of tension and then you press on the artery here. So relax. You have to distribute the support over the 3 contacts. Yeah? So you can do it even with 2. Yeah? That's a little bit of a help. Yeah. Now, a lot of the students would end up doing that. Yeah. Try to relax yourself. Work with your legs. A lot with your legs. Yeah? So, let's start looking at the position. By the way, this is the 4th one. So 1, 2, 3, and that's the 4th one. And usually, on an advanced level, I will start massaging, doing petrissage, or even trigger points with that. So stretching the muscle with a trigger point, relaxing it. Maybe the camera can come a little bit more closer. So putting the hand here on the upper trapezius and just stretching the muscle and relaxing. Yeah? Stretching and relaxing, and my hand still is on this position. If you want, you can go around here and have a look. Yeah? So stretching and relaxing. Well, you can come maybe even around. You will just have a better opportunity to watch the wire only. Yeah? Yeah? So now, what do I actually move here? Which, right, it is the shoulder, but which bone do I move? The clavicle, humerus, and the scapula. Yes? So it's actually from here, imagine that, I'm taking that, and then when I lift up, those rotate upward, so clavicle and scapula, and then I take it down. So I move all these 3 joints. When I do this movement, do I move the shoulder joint much, or it's mostly the scapula and the clavicle? Scapula, right.
So then you're not going to dislocate the shoulder?
It's a lot safer. So there is a difference between doing that and doing this. Do you see? Or taking the arm to the side. Yeah? So there is a difference between doing that movement, which mostly moving the scapula, and then doing that. Or even this movement. Okay? So what I would like you to do is 2 things. First, I want you to practice on the hold itself. So hold it in 1 position, position 2, 3, and 4. And then move your body. It's a good exercise for us therapists because I don't want to see that. It's nice for dancing, but I want you to move your body. Yeah? So side to side. My leg would go like that. It's like a preparation for tango. Yes? How to dance. Yeah? So side to side. So this is the first thing. I want you to start feeling comfortable with doing that. Then after that, I want you to start moving. Moving the joint upward. And then do a little bit of a stretch. And then downward. And do another stretch. And when you do that, try to distribute all your positions of your hands in a way that would not create them to have a blockage of the blood circulation. So here goes 30% of my clumping. How would I say it in a nicer way? Contact, my grip, yes. Here is another 30%, and here is another 30%. So keep your hands still nice and supportive. Especially here, the tendency is to grip too hard, like there is a handlebar, and then you want to get the hand this way. So be gentle with, yeah? And have a complete nice grip all over the 3 positions, 4 points of contact. Okay? Any question?
You seem to rotate upwards slightly. When you do the stretch,
Yes.
you tend to slightly rotate
Yes.
upwards as well.
Yeah. What happened, look at that. When I look at the arm, okay? When I turn it, naturally what happened is that there is a little bit of a turn that way. Yeah? Can you try to do it yourself, yes? Put your hands forward. No, sorry, put your hands backward. So your palm facing backward. And try to, on the side, lift your hands all the way up. Good? Do that. And then put your hands outside, like that, and do it. Which one is easier? The outside. Why? Because when you do that movement, it's sort of rolling your shoulders, and it's a lot harder to move. So when you turn the client's hands, then it's always easier to do it with that position and not this position. Yeah. Last note: we come in different sizes and shapes. Yeah. So if you have a client with a long limb, you might find out, and instead of putting your hand there, you need to come a lot closer. So look at the hand sticking. It's all question of proportion. And then you could come a lot closer. Sometimes I would really treat someone with being quite close to them. And then it will, the closer you are, remember, the easier it is to treat. Great. Take your arm outside. Thank you. A few things that I've seen. Usually, body position quite good, very good, and also the support is quite good. One thing that needs to be enhanced is that try not to lock the elbow, because when you're locking the elbow, it brings tension to the whole system. So try to bend the elbow, and then however you bend the elbow is by putting your body forward. And you do it with your hip. Yeah? So you like sitting and do that. What I want you to come and see is from that side, because it's quite amazing to think about it in this way. And that's the pumping effect of this technique. Now, what happened here is the muscle is in stretch, and I can even squeeze it. What happened to the blood circulation when I stretch the muscle and do it? The blood comes into the muscles or goes out? Goes out. Good. And then when I lax it, the blood comes in. So again, out, stretching it, even putting a bit more tension or squeezing it, and then in. And then out. So when we talk about massage as moving the fluid and helping in so many other ways by improving the fluid circulation, that is a fantastic technique to work on someone that has quite ache. The muscle always in tension. When the muscle tension, blood circulation cannot get into tense area. It's like a sponge. If the sponge is tense, not much blood can go there. So think about it as really as a well, we talked about joint, but actually it's a lot of stretches, and it takes it into a different area when we talk about the upper shoulder, back and neck, yeah? Sorry, upper back, neck and shoulder, in which suddenly we're having this trapezius pain, constant pain that a lot of people suffer, into a better technique, yeah? It's one of the muscle, the just tension in the muscle has a specific name, and it's called trapezius myalgia, which is myo is muscle, algia is pain. So it's almost so common that has a name specifically in medicine, trapezius myalgia. Okay, right. So that's one, yeah? I want to show you a bit of technique when you do it when you flex the shoulder upward, yeah? So maybe the camera can go around. Good. Now, in this technique, again, you're having 3 or 4 positions of contact. So 1, 2, 3 on their biceps. And the 4th one, we can work now on areas that usually massage therapists don't even touch. Yeah. Which muscle am I on? On which bone am I on here? Scapula. Good. And on which muscle am I? Good. It's hard, isn't it? No, supraspinatus is above.
Oh.
Infra.
Is it infraspinatus?
Infraspinatus, good guess. Yeah, could be. Yes, a little bit
Oh,
of
is it the
infra.
teres major?
Teres minor and teres major. And big one,
Oh,
No.
latissimus,
latissimus dorsi. So these are the muscles that attach to the lateral side of the scapula. So maybe if I have that bone over here, here. So once I'm here, I flex, look what I do. I elevate the shoulder and I treat from here all the muscles that attach from the lateral border of the scapula to the arm. And even more, all these ribs expose. Yep, sorry, then we have to be careful that. Good. So when it comes to, first of course you need to rotate the arm that way, hold it, and then all the feel the ribs, and then below the ribs is the lateral border of the scapula, and you can massage the teres major, teres minor, and latissimus dorsi. You can do a nice lift up here, so you actually stretch and almost like show the camera into me. How many of us in our day-to-day life go and pick apples or bananas or climb the trees? So how amazing that a lot of us suffer from hyperkyphosis. Can you show me what hyperkyphosis is? Yes,
Yeah.
that's computer shoulders, yes, this position. And if you start stretching it, yeah, it's changing posture. Changing posture is quite good. Yeah, it's like the difference between swimming breaststroke or back roll. We need to open up the front of the chest, and that technique can do that by stretching it up, yeah, giving a nice traction, massaging the trapezius muscles. Yeah, if you want, if you can come to the other side, you can do the deltoid and the upper trapezius, but you see that I need to change side for that, because it makes sense that I will work on the outside here and here on the inside muscles. Yeah. Also, we did remember we did oscillation. Yeah. How about that? When you move it in and out, and breathe in and breathe out, and you squeeze the air out, and you breathe in, and you're helping them, and breathe out, and breathe in, and breathe out. Yeah. So let's call it the upper approach, and you can do quite nice technique with. I wouldn't like you to start using oil, but I want you to get the approach of still supporting here and mobilizing. Few cautions. Yeah. Certain people, especially elderly, they would have a lot of problem to raise their hand above this level. Can you see you doing that to them? Quite hard. So we have to think about where is the end range, how much the bone, the joint can move. If the joint can move up to here, about more than 90 degrees, that's where you're doing it. That's it. You do that very little. Most people, it's not a problem. But when it is a problem and you feel okay, stop it here, lift it, stop it there, yes. Well, I can't do a lot more, so I will do a little bit more. And you should feel what's the end sensation of it. Yeah? If you can just take that, maybe on top of it, here, here. Put it here. Just making the noise. So, when it comes to range of movement, then you cannot exceed it too much. Yeah? And be careful on, as we said, all those who are having shoulder dislocation or rheumatoid arthritis or any condition that involve the shoulder, then leave it. do not do that. Yeah? Osteoarthritis, for example, can be beneficial only on the chronic stage when it's not that bad, and only to the amount of that they can do. If they can do up to here, you leave it and you encourage it a little bit more. Okay? So I want you to try now the upper approach. First of all, try coming, do a few things. First, come to here, and I want you to be involved a lot more with your other hand, with your application hand, to do massage here. You can do quite a lot also. You can move the head and then put the head here and do nice stretch. So one hand go this way, the other hand go the other way. And I'm on the occipital bone.
This way.
Yeah? Or you can just do that in here. Just hold it. Very little and long. And you can move it. So I don't put a lot of force. Good. So this would be the first one. And then also you can do that to the neck muscles. Yeah. The second one, what I want you to do is come to the upper approach and start with the triceps, lateral muscles here, the teres major, minor. You're not going to feel them separately. Okay? I don't want you to look, but try to palpate as much as you can. And then ribs. Okay? Fantastic, good.